Are you finding it tough to stand up after you've been sitting for a while?
That's right. Oftentimes, people's knees get stiff after a long-term sitting, and that weight bearing and that movement up just becomes painful. And we're going to show you how you can easily get rid of that with just a simple exercise and maybe 2, maybe 3. So, Mike, let's talk a little bit about why the knees develop this stiffness and pain and why the remedies actually work.
So typically when we're sitting for a prolonged period of time, we have no movement in our legs. This decreases the blood flow to them, the circulation, causing the muscles, tendons, and joints to kind of stiffen up. So the longer you sit, the stiffer you're going to be.
And actually, if you have some arthritic pain, that happens to be increased because of synovial fluid, the lubrication between the joints also is not where it needs to be. So doing these exercises spread that lubrication out, which is a great benefit for your movement and weight bearing.
So for some people, this can be more of a issue or concern when you sit prolonged periods of time, especially when traveling, because that is a way to possibly develop a DVT. Obviously, if you're young and healthy, this isn't really a risk factor for you, but just keeping your legs moving like we're going to show here in a second can help with that as well.
Now, if you're not familiar with a DVT, it's a deep vein thrombosis or a blood clot, oftentimes formed in the calf muscle from long-term sitting.
So the first exercise we're going to show is going to activate the knee joint itself, quad muscles and hamstrings, and it's simply kicking out straight. We call this long arc quad in the therapy realm. Very simple, easy to do. If you have a limited range of motion, just go to what's plausible or possible for you, move out a little bit and then come back in. Try to work into the full range of motion, but there are some other options you can try as well.
That's right. And it's important to do these slowly and with some real definition as high as you can. If you want to move your ankles as well, we're going to talk about some activity with that in just a little bit. But again, Mike really brought up the good points, full range of motion or as close as you can. Now, depending on how your mobility and flexibility is, you may want to actually work some flexion or bending the knee as well. After you do 10 long arc quads like that, then you can bring the knee up and flex it. So we get a little more range of motion if it's comfortable, or you can start out a little bit and just bring it up. And sometimes that can be a real relief right there. So that way you get the full range of motion and do 5 to 10 of those on each leg. Sometimes it works better to actually put your hands underneath the knee and pull up, and that can actually distract or get the joints to separate just slightly.
Another option to get some circulation and movement in your legs, say you're stuck in a car or plane or train, whatever, you're not going to be able to kick because there's a seat in front of you most of the time or the dashboard, whatever. So a good option is to simply do some ankle pumps in a seated position. If you have your knees bent, you're going to end up kind of rocking up on your toes and then back on your heels like that. If you have the room to stretch out, you could certainly do this in a straight leg position as well. But simply doing 20 to 30 leg pumps can help keep that circulation going in your legs when you're stuck in this position for a prolonged period of time.
I like to call them ankle pumps, Mike, not leg pumps. But you can call them whatever you want.
Pump it up.
Anyways, yeah, it really does. That because the circulation in the feet also it gets delayed. It actually pools down there. So motion in the ankles is really beneficial to get that fluid up where it belongs.
So remember, these simple movements can make a big difference on how you feel, and it can keep you moving and make you feeling better.
Yeah. Sit to stands are easier now.
So if you want to check out more videos on knee pain specifically, you can click the video link on the screen, 10 typical pain spots and what they actually mean.
That's a nice one because it gets right to the specifics.
Bob and Brad, the two most famous physical therapists.